So
Okay.
I think one of the hottest topics, both for me personally and across the industry, and I suspect, is how do we address the EMR, whatever brand you're on's role in provider efficiency and satisfaction? So, people say physicians are burned out. I was at a social event the other night, and the neurosurgeon next to me kind of heard what I did and immediately started complaining about clicks to me. No joke. Doesn't even work at anywhere where I've worked, but I hear about the clicks. And so I think we're really we're beginning to address that. And one of the most helpful tools, so I did a project on that at my last organization, but his class is doing this Arch Collaborative. And I think we're getting some really good, fascinating data. And so what class is doing is they're asking, I think they're probably close to 120 organizations, and they basically say, hey, to all the users, do you agree, how do you feel about, does your EHR enable you to deliver high quality care? And then kind of like when we do population health, you look for the bright spots. So what are the characteristics of places where everyone says, yeah, it's pretty good here, the EMR? So it's not what you think. So you ready for the big surprises?
Sure, love it. So you're going to share some of the things that Arch Collaborative found?
Yep, with their initial findings, and that I've also had personal similar experience, but I think it's more powerful to talk about this national data.
Absolutely.
So they found, I'm going to give the big surprises first, that IT spend doesn't correlate. Voice recognition doesn't correlate. And scribes doesn't correlate with improved user satisfaction.
That's wild. That's hard to believe, actually, because you hear that a lot. If I didn't have to do the data entry, this whole thing would be fine. That's an interesting finding.
So, and in fact, this week, JAMA had an article about scribes and satisfaction in 18 PCP practices, which shows the opposite. So then, now that I've kind of reined up, everyone's assumptions, what are successful organizations? And what they found, and I personally found, is it's really about how do you help support the users to use the EMR, and it's robust, high quality, or at least the perception of really good training at first. It's ongoing support and the ability to personalize, which I tie to ongoing support. And one of the things that I really think, and it hasn't been borne out yet they haven't gotten as granular, it's ongoing ownership and engagement of the physicians. They need to have some ownership and engagement, not each and every one, but like someone in each specialty needs to own the content and understand the software. And that's what really makes a difference. So I just, one of the things is the organizations that haven't had good data keep trying to, it looks like they throw money and technology at it. While the organizations with high user satisfaction seem to have more of a culture of support and a relationship with IT. And the other thing is that everyone complains about entering the data, and this is my concern about the JAMA articles. No one talks about getting the data out, which is as important as entering the data.
Right.
Awesome.